Influenza, commonly known as the flu, is an infectious disease of birds and mammals caused by RNA viruses of the family Orthomyxoviridae, the influenza viruses. The most common symptoms are chills, fever, sore throat, muscle pains, headache often severe, coughing, weakness, fatigue and general discomfort. Although it is often confused with other influenza-like illnesses, especially the common cold, influenza is a more severe disease caused by a different type of virus. Influenza may produce nausea and vomiting, particularly in children, but these symptoms are more common in the unrelated gastroenteritis, which is sometimes inaccurately referred to as stomach flu or 24-hour flu. Flu can occasionally lead to pneumonia, either direct viral pneumonia or secondary bacterial pneumonia, even for persons who are usually very healthy. In particular, it is a warning sign if a child or presumably an adult seems to be getting better and then relapses with a high fever, as this relapse may be bacterial pneumonia. Another warning sign is if the person starts to have trouble breathing. Typically, influenza is transmitted through the air by coughs or sneezes, creating aerosols containing the virus. Influenza can also be transmitted by direct contact with bird droppings or nasal secretions, or through contact with contaminated surfaces. Airborne aerosols have been thought to cause most infections, although which means of transmission is most important is not absolutely clear. Influenza viruses can be inactivated by sunlight, disinfectants and detergents. As the virus can be inactivated by soap, frequent hand washing reduces the risk of infection. Influenza spreads around the world in seasonal epidemics, resulting in about 3 to 5 million yearly cases of severe illness and about 250,000 to 500,000 yearly deaths, rising to millions in some pandemic years. In the 20th century, 3 influenza pandemics occurred, each caused by the appearance of a new strain of the virus in humans, and killed tens of millions of people. Often, new influenza strains appear when an existing flu virus spreads to humans from another animal species, or when an existing human strain picks up new genes from a virus that usually infects birds or pigs. An avian strain named H5N1 raised the concern of a new influenza pandemic after it emerged in Asia in the 1990s, but it has not evolved to a form that spreads easily between people. In April 2009, a novel flu strain evolved that combined genes from human, pig, and bird flu. Initially dubbed swine flu and also known as influenza or per hour 1N1, it emerged in Mexico, the United States, and several other nations. The World Health Organization officially declared the outbreak to be a pandemic on June 11, 2009. See 2009 flu pandemic. The WHO's declaration of a pandemic level 6 was an indication of spread, not severity, the strain actually having a lower mortality rate than common flu outbreaks. Vaccinations against influenza are usually made available to people in developed countries. Farmed poultry is often vaccinated to avoid decimation of the flocks. The most common human vaccine is the trivalent influenza vaccine (TIV) that contains purified and inactivated antigens from 3 viral strains. Typically, this vaccine includes material from 2 influenza A virus subtypes and 1 influenza B virus strain. The TIV carries no risk of transmitting the disease, and it has very low reactivity. A vaccine formulated for 1 year may be ineffective in the following year, since the influenza virus evolves rapidly, and new strains quickly replace the older ones. Antiviral drugs such as the neuraminidase inhibitor oseltamivir Tamiflu have been used to treat influenza. However, their effectiveness is difficult to determine due to much of the data remaining unpublished. Symptoms of influenza can start quite suddenly 1 to 2 days after infection. Usually the first symptoms are chills or a chilly sensation, but fever is also common early in the infection, with body temperatures ranging from 38-39 C approximately 100-103 F. Many people are so ill that they are confined to bed for several days, with aches and pains throughout their bodies, which are worse in their backs and legs. Symptoms of influenza may include fever and extreme coldness, chills, shivering, shaking, rigor, cough, nasal congestion, runny nose, body aches, especially joints and throat, fatigue, headache, irritated, watering eyes, reddened eyes, skin especially face, mouth, throat and nose, petechial rash in children. Gastrointestinal symptoms such as diarrhea and abdominal pain may be severe in children with influenza B. It can be difficult to distinguish between the common cold and influenza in the early stages of these infections, but a flu can be identified by a high fever with a sudden onset and extreme fatigue. Diarrhea is not normally a symptom of influenza in adults, although it has been seen in some human cases of the H5N1 bird flu and can be a symptom in children. The symptoms most reliably seen in influenza are shown in the table to the right. Since antiviral drugs are effective in treating influenza if given early, see treatment section below, it can be important to identify cases early. Of the symptoms listed above, the combinations of fever with cough, sore throat and/or nasal congestion can improve diagnostic accuracy. Two decision analysis studies suggest that during local outbreaks of influenza, the prevalence will be over 70%, and thus patients with any of these combinations of symptoms may be treated with neuraminidase inhibitors without testing. Even in the absence of a local outbreak, treatment may be justified in the elderly during the influenza season as long as the prevalence is over 15%. The available laboratory tests for influenza continue to improve. The United States Centers for Disease Control and Prevention (CDC) maintains an up-to-date summary of available laboratory tests. According to the CDC, rapid diagnostic tests have a sensitivity of 70-75% and specificity of 90-95% when compared with viral culture. These tests may be especially useful during the influenza season, prevalence equal 25%, but in the absence of a local outbreak, or peri-influenza season, prevalence equal 10%. On the more serious side, influenza can occasionally cause either direct viral or secondary bacterial pneumonia. The obvious symptom is trouble breathing. In addition, if a child or presumably an adult seems to be getting better and then relapses with a high fever, that is a danger sign since this relapse can be bacterial pneumonia. People with the flu are advised to get plenty of rest, drink plenty of liquids, avoid using alcohol and tobacco and, if necessary, take medications such as acetaminophen, paracetamol to relieve the fever and muscle aches associated with the flu. Children and teenagers with flu symptoms, particularly fever, should avoid taking aspirin during an influenza infection, especially influenza type B, because doing so can lead to Reye's syndrome, a rare but potentially fatal disease of the liver. Since influenza is caused by a virus, antibiotics have no effect on the infection. Unless prescribed for secondary infections such as bacterial pneumonia. Antiviral medication may be effective, but some strains of influenza can show resistance to the standard antiviral drugs and there is concern about the quality of the research. Pinky D77